Aloha! Hi, it's Julie with Aloha Medical Mission, and we're going to go over a packing list for our mission this October. So first we're going to go over documents. We're going to go over the clothing and electronics and the consumables we'll be needing for the mission. So first, the passport, of course. So people carry their passports in packs, little holders. Usually I take mine out each time. I put a little tab there because to find your photo part, it's just a little easier to find. So you have your passport, then you have a color copy of your passport, which you can keep in a separate part of your packing system, meaning your check-in versus your carry-on. And also I suggest a soft copy, so something you can pull out from the cloud or the drive. So if something happens, there's a way for you to retrieve it. Next is to have a itinerary of your flight. So for me, like Emerson Travel, I went through Tracy. With that itinerary, you also want the itinerary for the mission, which I'm jumping to the end, but to keep it in one place would be easier to grab in a container of sort, then you keep in your backpack or whatever carry-on you have, so you can get it faster. And then in this same folder, you'd want to keep a copy of the customs letter that I will be sending out to you. I'll send you out a PDF, which you could print out along with the itinerary that Bikash will have, and then the letter, the AMM, and the inventory that you'll be having for your mission box or bin. Also, your credit card and your travel insurance, which is not mandatory, but it's good to have just in case, because this is a longer mission. So for Nepal, I usually buy some type of travel insurance because it's going to be closer to 3 weeks. And if you travel before that and after that, it could be as long as a month. So you just want to make sure you're safe and you have a little safety insurance for yourself. Yeah. And in credit cards, I carry certain credit cards with me in my wallet. So usually I want to be aware of, like, does your credit card have any fees internationally? So most travel credit cards don't have international fees, but other credit cards also might give you a hard time if it's not international, because for a fraud insurance, they'll decline your card. So if you need to let your credit card know that you'll be traveling in that time, usually on the website or the app, there's a place you can pay that, inform them that you'll be traveling for this amount of time in these countries. Okay. And then again, the mission itinerary will be printed out. We have a temp run right now, so right before the mission, probably right after our Zoom meeting, I'll give you the one that's going to be more, not the permanent one, but something that's going to be closest to reality. Okay. Next, moving on, is the clothes. What are you going to wear? What are you wearing? So for the hospital, you have to have scrubs. So I say about 3 to 4 sets of scrubs, and we will be able to do laundry there in Dakuta. So for my scrubs, I put them in, I like to use packing cubes for my things, so it keeps things in order. So, and this is one of those compressible ones as well. So you have tops and bottoms, you put in one area. And for your scrubs, we change into our scrubs in the hospital, but you wear your street clothes going to the hospital. And that way we keep our patients safe by keeping everything clean as much as possible. So packing cubes for your clothes. So what I have here also is, like, I keep like my tops and bottoms, like in the packing cubes. 3 or 4 pairs of shirts. I have, I use double. I got the Ziploc on top of having the packing cube as well. So the Ziploc, you can use it for other things when you get in country, and it keeps things like, waterproof for the most part. So I have my tops, my bottoms, and it keeps things organized, because sometimes when people visit your room and everything's everywhere, it's going to be a hot mess. Oh my hot mess. So slippers, which I have also here. You're going to need a couple of slippers. One would be for in your hotel room, or your in the Saravi, Machunga, or Anjuli. I think one more hospital. So you use a pair of slippers, and of course your shoes for the mission. And then there's also the slides or the Crocs you can use for the OR. So I don't have that packed here, but something that you can leave there also. It is a bit bulky, but they're lighter things to pack, so that's not too bad. Okay, and then the lab coat for our physicians, because we do want to present them as professionals, that they have the lab coat. And that way we can spot you easy in a crowd. It does make you a target, but a good target. Yeah. Comfortable shoes, I just pass it on. So I choose you, Pikachu. No, I choose the Skechers because the price is affordable. I like these because you can slip your foot inside without getting that part all scrunched up. Yeah. So this is what I choose here. And then, yeah, for walking around, you'll be on your feet a lot. So you want to make sure you're comfortable because you're worth it. All right. So I'll be making you some name tags. You'll get it in Kathmandu. So that one we always try to keep it on our person so we can identify you because we will just be meeting all together in Kathmandu for the first time. So I'm gonna be able to make sure we know who you are. And then for people around us, they'll see that, hey, those are special people. All right. So with other stuff for the hospital, we always consider like bringing a backpack, a little smaller backpack. You know, sometimes I use one of these reusable bags, or sometimes you might want to have a tote. So I like this tote. It's one of my favorites. So this tote has a pocket as well. So it's nice, light, foldable, attractive. Okay, so there's that. All right. That's the hospital, like clothes and whatnot. So clothes for around the hospital or things before the hospital. So shirts, pants, leggings, long sleeve, because as we approach winter, because it's going to be the beginning of October when we start, it's going to start cooling off. So the more early mornings and the getting to after sunset, it gets much cooler. So having like a light jacket, the inside lining, like some people use it in the hospitals, like at work here, we use like those like thin under long sleeve thingies. Those are usually helpful. You can layer. The important thing about traveling is being able to layer your clothes. So something light that you could have to peel off away the clothes if it gets hot and to put back on if you need to. So puffer jackets are nice because they roll up pretty easy and it takes up less space if you roll it up nicely, which I am not doing at all. So with that, your light jacket is there. And your hiking shoes, they could be the same thing as your shoes you might use in the hospital. It depends because hiking shoes can get quite bulky. So it depends if you're also going to be doing that after the mission. Stay safe. So with that, we will have a couple of days off here and there. I like to keep a cap going through like when we're traveling to protect myself from the sun because I am a delicate flower. And of course it says aloha. Nice. So with that, along with your clothes, you're going to have pajamas at night. If you wear pajamas at night, I'm not judging much. Socks are important because it keeps your feet comfortable. I put my socks. You see it? So socks. You see? I have regular socks and I have compression socks. So they're good for our long days. We'll be on our feet, just like we are here at home. And the travel is going to be that's going to be the longest flight I've ever had. It's from, where am I going from? LAX to Singapore is like over 17 hours. So that's going to be something that will be a new experience for us. So you want to make sure you have compression socks and make sure when you're in the airplane, make sure you move your feet, keep the blood flowing. And I know I've been told like you can take aspirin also. That's something you're concerned about because we don't want anyone to get sick. And it's a long flight. So compression socks for work and for travel time. So with that, I usually like wash my socks in my room and then just hang them in the laundry thingy. We'll go over that in a minute. So I usually bring about 4 pairs of compression socks and then another like 2 or 3 pairs of the regular like shorter socks, dress socks. And those are underwears. You do not need to see that. Mine, stop it. Okay, next. Pajamas, socks, slippers. I talked about the slippers that I have here for the shower. Underwears, whatever you wear under there in your underwear, make sure you pack enough. And some people will treat them like disposable because I know a lot of things kind of collect as we collect all our things together when we pack. A lightweight towel is nice. So this is the one I have here. It rolls up pretty nice. It dries. It patsy. I don't know what is. Most of the things I bought is from Amazon. If you want to know like which one specifically, just let me know. So this opens up pretty well, and I dry it in my room. So this is and it rolls up pretty tightly as well. So I have this. It can serve as a blanket too in the airport, when it gets cold there, or in the airplane. Although they give you one in the airplane, yeah. Okay, also a nice outfit. Nice outfit for the end of the mission. They usually give us a celebration to be showing appreciation to us. So we always try to bring something nice to wear, and people get all dressed up. It's really nice to see. And in Jakarta, they have many shops there where you could get like something like more local made, like custom made, maybe the week or a couple of days before the event. So there's saris and kurtas, and for the guys they have these vest thingies and the topi hat thingies. It's really kind of fun, and it gives honor to their culture as well. Yeah. Okay. So consumables. Next, am I going too fast? You can slow the video down if you need to. Consumables, well, drugs, personal drugs. All right. So for your medications, your prescriptions, you want to keep them in the bottle that they came in, that they're coming in, because in case customs questions for that type of thing, you want to make sure that, hey, this is Julie's Xanax. So with that, you want to make sure you have more than the 3 weeks time, just in case something happens. It's good to have an extra supply of that. So prescription drugs, again, with your name on it, keep it in your carry-on, because if you need it then, because sometimes luggage gets lost. That does happen, sorry. So, and with the rest of the medication, like as far as vitamins, so for that, I know I get mine from Costco, so it's big and bulky, so I actually do decanter the vitamins, if you will, into like a smaller type of container. So, and also my other medications, which we'll go through eventually as we go through here. So vitamins, insect repellents. So there's liquid versions, and they have people that have those little clips, those little bands, all those things. So mine is liquid, so you gotta make sure, like I'm only doing carry-ons, that make sure it's less than the 3 ounces that TSA allows. So this is more natural things. Yeah. So I have this one, and then I have another one that's also more natural things. Again, liquid, so be mindful of liquids that you keep. So I keep mine in another, you guessed it, Ziploc, sponsored by. So put them together over here. Allergy medications, hand sanitizers, allergy medicines, hand sanitizers. I put it all around me, and then I misplace it. See it? And so the allergy, as you know, this medication, that's Benadryl, that's an allergic reaction. But if you have like citrazine or Allegra, is that Allegra? Those type of things, it's good to bring, because you never know like the different allergies you might have in the area, because the flora and fauna might be different. You touch something, it might be like a interesting reaction to your body. So, but the hand sanitizers, usually I have them in all different packs. On my backpack, my little fanny pack that I carry around. And then, it's funny, I have them everywhere, but I can't find it now. It's okay, trust, I have it. All right, next, moving along, wipes. Wipes are good to have, for cleaning anything decent. If you need to sanitize an area like you're on the plane, the tray table, you want to wipe that down. Sometimes I think United does it, where they give you a little hand sanitizer thingy, or just an alcohol pad. Those are free at work, so you can just wipe down your that. And feminine products, it's good to carry some feminine products. I know you don't need to see that as well, but you don't want to get caught without them, because when you're out there, you don't want to have to hunt for them, because it's going to be like, you know exactly what size you need and what brand you prefer. So I always suggest bringing that. And if you don't need it, then maybe someone else might need it. It also comes in good as a band-aid. And so fan products, collapsible water bottle. So I like them because, well, they're light, they're small, and this one, again, Amazon. So after you get past TSA, you can fill your water bottle up. And this one I have here, I like it a lot because this has a straw. So this straw collapses into the bottle itself. You're just gonna make sure to keep it clean, like the straw, so you don't get sick. And I know people have their Hydro Flasks, their Yeti. Those are all really good products as well. But when it comes to space and weight, it's not the only game in town. So this is something I like to keep on my bag. And I actually have a couple of these because I travel often enough to bring it past TSA and have to bring it. But again, it's your choice. Your preference is your preference. Know that in Nepal, ice water is not a standard. It's a more of an American thing to have ice in your water. So if you really cherish having the cold water and you want to bring your Hydro Flask or Yeti or whatnot, it's your choice. Just, you prioritize things. All right, so that's my glass of bong water. Next. Oh, Pepto-Bismol. So back to the medications. So Pepto-Bismol, it comes in liquid form, as you know, that pink stuff, but they also come in tabs. So, it's for upset stomach or things beyond your stomach. But it also helps as a prophylactic to prevent any tummy illnesses. With that, instant coffee packs, people have those. I think there's different brands that sell them. Coffee and tea, and what was it? Coffee and tea bag. Yeah, that's good. And also, in that same vein, you have hydration packets and things like emergency, because we're going to be working long, hard days, and we want to make sure you stay healthy and hydrated. So every so often, we'll have everyone making sure everyone is drinking enough water, and that your pee is not amber in color. So with that, please stay hydrated. Healthy and hydrated. That's what it's all about. All right, motion sickness. Yes. So with that motion sickness, we will be traveling by bus and of course by plane, as you know. So from Kathmandu to Biratnagar, we're going to be traveling by plane. And that's when I usually suggest for people to take whatever motion sickness medication they're going to take, because it takes about 45 minutes or so to kick in, depending on your metabolism. But then that's great planning for that. When we get to Biratnagar, we have that like 4-hour bus ride into the mountains, and it's up, then it's down, and it's up, and it's down. And then you get a little... And some people have their own like concoction. I know some people that like will do the meclizine or Dramamine, and then they're on top of a scopolamine patch. So you know what works for you, or find out before it happens. So sometimes I'll pre-medicate with the meclizine depending. So definitely motion sickness, if you don't get ahead of it, it could ruin your whole day. I've seen it. It's not pleasant. And the ride can be not treacherous, but it can be uncomfortable if you're feeling motion sickness. All right, acetaminophen and ibuprofen. If it's good enough for our patients, it's good enough for us, because that's what they're giving them post-op mostly. So that's why I have a lot of those things. And also for me, I carry naproxen as well. So if you need drugs, Costco carries it. Not kidding. You can always ask people who carry medication. You can always come to me and ask for medications as well. Decongestant. So when people get sick in Nepal, it's usually going to be something respiratory or stomach. So having something for both of them, so like decongestant or like Mucinex. I carry cough drops because after a while I'll talk too much. So like having something that helps you respiratory wise, I'll carry one in like my carry-on portion, and I also carry another one in my little bag and I opted for like sugar-free, so if it's like lingering in my mouth longer than used to, I don't want to get cavities. Yeah. Cough drops, snack bars. So we are lucky to have a dietitian come with us, nutritionist. Yes. So actually they had brought these different options here. So these are, I think these are Costco sells this too, right? So these well, it can be any bar. So protein is important. It helps you get you through the day without the sugar crashes. So as much as like we like the sweets, we want to make sure to have enough protein in our body to function and keep in a good metabolism. So this has like egg whites, nuts, and cashews and dates, all good things. So this is RX bars. I know they carry this at most of your stores. You can buy them, I'm sure, on Amazon too. And also you can carry like a little packets that has like peanut butter. For like peanut butter, you don't want to bring the whole jar. You have packets ready to go, just like that. Oops, here's another option. And then if you're not the bar type of person, so you want some sticks of meat, you can chomp on this. I should get paid for this. You can chomp on this. Okay, so those are also portable, light. You can go inside of your pack really easy, just like that. And this is handy too when you get there. Snacks, you want something salty, which is good for you also. So this is like miso packs also. You just need hot water, which we have a lot of over there. When we get to Dankuta, they'll have little heating sources to get hot water from. So, and this has 8 packs in this, and this has like little tofus and seaweed and onions. Yummy, tasty. Thank you. So snacks, I know we will have lunch and whatnot, but sometimes people want to power through certain things. I recommend you just take your break to make sure to sit down, go pee, go eat something. But I know some people carry little snacks to get them through the day, especially like the power bars will help a lot. Okay, snacks and ramen to get to. Oh, I missed the small gifts for local people. So there's different things, and usually local people, it's for the kids. We'll bring some toys for the kids, but mostly it's our patients. But things like bracelets, bring little stickers. Some people will bring postcards of Hawaii, just to know where they're from. I bought a bunch of stuff when it's on sale, like the hand sanitizers, the nice little smelling ones that I packed with our things for the mission. So those little gifts, you can bring them as well. So it's up to you. You don't have to, but it's something that we like to do. It's not mandatory. Don't feel pressured. All right. So snack, contacts and glasses. So usually I'll be wearing my glasses. I'm wearing my contacts today because that's the way the weather went. So the contacts, it can be drying when you're traveling, so I usually carry my glasses. and I keep it with me, and it helps when you're in the hospital as also as protection from splashes. I know the sides aren't protected so much, but it's the full frontal. You won't get splashed with whatever bodily function is coming fast at your face. So I keep my glasses always near me, so I travel with them. Put that there, it stays in my backpack as well. Eye drops. So I have eye drops in different bags too. As much as I have my lip balm, I will have eye drops. I like to keep my face moisturized. All right. Here we go. So the toiletries. So my bag is right in front of me here. So toiletries, and everyone is like different, right? Because you have your different skin needs, pH balance, whatever it is. But toothbrush, toothpaste, a comb, things that keeps your fellow volunteer in mind, because we have to look at you. No, just kidding. So Q-tip, shampoos, hair conditioners. I know I've chosen to ride with, these are bars for soap and conditioner. Soap, conditioner, shampoo. So it's, of course, it's dry, so you don't have to worry about TSA, like how much cc's is that. And people carry those, you can refill your bottles too, but it's just a nice little bag that collects here. And this is a waterproof bag that I bring things in. So there's different brands, whatever works for you and your hair. You know, you can find that out. And this balms, conditioners, dental, hair floss, all these things that you probably do carry already. Something that I got recently that I really enjoy, I don't know the right words, is it's not deodorant, it's sunblock. Yeah, it's a Korean brand, it's 50 SPF. So put your arms, your face, your forehead, your ears, all over your body. Okay. And it smells pleasant too. Anyways, there's that. Don't forget, dentures, retainers, shavers if you're hairy, or if you want to let it grow and just go natural. No one's gonna judge. So with that, if it's important to you to shave, don't forget your shaver as well. So for the long haul flight, the 16, 17-hour flight, I try to keep everything close to me that I need. So again, like the lip balm, the eye moisturizer, I also have the hand moisturizer. So most airlines will give you something for the longer hauls, but just in case they don't, I have those things ready. And also, you want to have, this long flight, and in a perfect world, you can sleep most of it, but I know I will not. So on my phone, I will download movies, games, things to keep me occupied, maybe go through like some of the mission information. So you want to keep your phone charged. So I have Yoda here, so I have that separate little plug. So everyone has a little different plug system, but this is the one I roll with in the airplane. So I have this plug, and then this is a USB, because I have the old school phone with the lightning port. So I have the USB to the lightning port connected here. Also has a type C, so it's one of those multiple, Yoda, multiple connections. With that, I do carry a power bank as well. I carry multiple power banks, but in my flight ones, the one that's reachable, this one. This is a 2500 amps, so that's in milliamps. That's enough for one charge, but most times you use a plug for in the airline. So I'd use that first before depleting this. So like having it like for the long bus ride, all those kind of things, having a portable battery is essential. So I'm not sure if you can see this, but I also have, so this is my small one, and this is my big one. So this is 2,500, 5,000, and this is like 20,000. So I'm not sure if you saw, it's connected to my laptop. So this actually has a lot of juice in it, and it plugs in different areas. So this one is Anchor brand. I'm loyal to mostly Anchor brand things, because if you want to spend money on something, it's important to you, you have to kind of splurge a little bit, but it depends on what's important to you. So that is the long haul thing. I have hand sanitizer, wipes, earbuds. So yeah, having like on the airplane, I keep also my earbuds close by, and or because it's a long one, I also have the headphones that go over your head, because nothing says don't bother me like headphones over my ears. Don't talk to me. Basically, don't talk to me. Don't you even think about it. So with that, I carry that in my backpack and my earbuds. I like the noise cancellation. Also, as I get older, I gotta protect my hearing. So that noise cancellation makes a big difference if you know. If you know, you know. Yeah. Neck pillow. So I don't carry that because I have to keep in mind like what I want to keep track of, by space-wise. The mask for your eyes covering. The airplanes usually provide that too, because it is a long haul. And then of course your phone charger. Like I got my my Yoda here. So that's my long haul bag, which I keep right in front of me, so I don't have to reach under the chair in front of me. It just kind of hangs there on top of that or on my body. And of course, like my phone fits here. On this too, I keep my passport and pens, because sometimes I take notes on my iPad. Just kidding. No, on my Post-its, just in case I have to remember something. All right. So other things to pack for the laundry kit, which is everyone does it differently. So there will be laundry there they'll have it in Kathmandu and also in Dankuta. The different hotels will do it differently. And if you have what do you call this, laundry, like I wash my underwears in my own place and I hang it up in my space. And then she'll give me this one of these things. You can have like either a line where you can hang things, or you hang on the door. You put like hangers there and have something to hang. This is, I know it's not most people you should carry, but it's handy when you want to do your own laundry and hang things and keep your private things private, like your underwear if you wear them. So having detergent, you can have the liquid ones like little packets, or there's the paper ones that you can tear. I think it's Earth something that uses them. You just mix it up with water and it becomes a detergent, and you can do your laundry that way. And with if you don't have those hanger thingies, I used to carry like a nylon rope to go one side of the room to the other, and I have those. I do carry those 3M hooks because I will need to hook things up once in a while if it's like just supplies of things. So the hooks and the nylon rope is something I used to carry a lot, and that's a laundry line there. So the clips like to put your clothes over it. So that's like the laundry kit, if that's something that is important to you as well. There's a lot of products on Amazon that provides those type of things, especially with the long trip that we're going to have. We're definitely going to need to do laundry at least 3 or 4 times. And if you think you don't need to do laundry, we will tell you when you need to do laundry. Yeah. So the portable battery pack, I did talk about that already. So the 5,000 or 2,500, which is about one charge for a device, meaning your phone, to 10,000, which is like 2 or 4 charges. So in I almost said Philippines. In Nepal, we have found it. So in Nepal, their adapters are the 2 circle ones. So if you have one of these doodads, every one of these guys, you do need an adapter for that because our plugs are not the same. Our plugs are usually this or the 3-pronged ones. So with that, they are round pins. That's called a type. The C type. The 2 has the round pins, and the type D has the 3 round pins the third one comes in. So this one you'll need adapter. On top of that, if it's a simple thing, you need a converter, because in the States our power is about 110, 115, and over there it's 220. So if you plug in something that's usually used to 110 into a 220, it's going to have a surge of electricity and it'll damage whatever electronics you have. I've seen that happen before, so don't do what I do. But I do know that iPhones, this is my laptop charger, these are already converters as well as the plug. So like if you have an iPhone or other Apple brand stuff, there's changers for those. So I have one of these in touch with like this. So this will go into there and here. And through this one here, I can charge my laptop. My laptop also connects to another device I can charge on top of that. Some people will bring like a power strip, so which would be me as well, because I have items to charge, not just for myself, but we have walkie-talkies through the mission. We want to make sure those stay charged because that's a part of our communication as well. So electronic-wise, you need a converter and an adapter. So, and sometimes it can be the same thing. I just bought something that does both. So, all right. So, and this is the website if you want to go to get more. If you don't believe me, that's fine. You can look it up yourself. Do your own research. But yeah, I don't want you to mess up your stuff, especially if it's like your phone, because that's like another appendage of ours, or your laptop or a device that has a lot of precious information on it, or pictures, The cell phone, of course, that is, again, our third leg, our arm, and earbuds and headphones. I talked to you about that. Having both is important to me because it's a long flight and I like to help preserve. It's the noise cancellation for me that helps me. Tablet, that's, tablet's like a laptop. AirTag or personal item tracker. So those kind of things I wanted to mention about. So AirTags will have them on some of our bins, not all of them, but most of our mission bins that has it has surgical instruments or like the cutting machine, they'll have the AirTag on them, and we'll share it with the appropriate team members. But something that I have that I keep on my, my passport that doesn't fall out, is this other brand. It's not AirTag, it's a flat one. So I actually have that here that stays by my passport. It stays affixed to it usually in the bag into the little envelope, so I can track it, and it's actually louder than the AirTag. So I keep one there, and I keep one in my wallet that keeps my credit cards and identification as well. I suggest if you do have it, the global pass. It's when you travel internationally, it's just another easier way to carry something, and actually does better than my own driver's license at the airport for some reason. So again, your personal item trackers, that's AirTag. You can keep on your backpacks, your essential equipment, like if your headphones, those kind of things, or if you want to put on somebody to track them. Because if I need to find Shiho, I'm going to put a tracker on her. Yeah, Shiho. Okay, thanks. All right. Hearing aid and batteries for them. Yes. I'm not there yet, but I feel like this is my future. So I encourage that anything that helps you communicate, hear us, experience the world in its totality, I suggest that. Portable speaker, because China already saw it. I will have to dance once in a while. I'm sorry in advance, but it's gonna happen. So having a portable speaker in your room, sometimes we'll play it in the OR. Just gotta be respectful of who else is listening to your music, that's all. And then the headlamp, rechargeable flashlights, all those things. I know people say, hey, I have my cell phone for that, which is great, but it's always good to have a different separate device to have. Lost it already. It's a little portable light. Can you see it? All this moving around. So it's a flashlight. I know. I found it. It's a little light here. So having a light that's rechargeable or the battery that lasts long, it's good to have on our device, because at the end of the day, we'll be traveling under the cover of dark. And the streets of Dankuta, there's some street lamps there, but there's some dark areas. It's just be able, not so much as a danger thing as a stranger danger thing, but the ground is not even. We've had people hurt themselves, like stumbling on like their own feet sometimes, like me, or just the uneven parts. Even be aware that in the hospital even and the hotels, that the stairs aren't always even or the ground isn't always level. So it's good to be able to see what you're doing or where you're walking into. Yeah. Hey, okay, all right, so flashlight. Oh, distress, all right. So I think that's the bulk of the stuff. Did I say mask? So staying safe, what we learned from the pandemic is definitely, trying to avoid crowds, which is unavoidable when you travel, but having a mask, cleaning your hands, watching how often you touch your face, those type of things. And as far as specific packing for the mission, for those of you that are in the OR or in the OPD or in the eye hospital, knowing what equipment that you need that you can't do without, please bring them, because we try to pack as much things as we can, but we don't have everything that's specific to each person. So if you need a specific type of N95 mask, please bring them. Or if you know what kind you have and don't have access to it, reach out to me and I'll help find them for you and source them. So gloves, masks, those type of things that are really personal. If you have like a latex allergy, make sure that you have something non-latex. I do believe most of our gloves are non-latex, but they're not all non-latex. So again, I want to make sure you're safe and you have the equipment you need to stay safe. Okay, that was a lot of stuff. Did I touch everything? I didn't tell you about my nail cutters. I need to have, if you cut your nail gets caught, it doesn't drive you nuts. I need to cut them. I need to buff it down to feel like it's all even. So I carry like a nail cutter, and we're there for like 3 weeks. It's gonna grow. Okay, it's gonna grow. So definitely need my nail cutter. And the other random things. I think that's the gist of the packing. It sounds like a lot, but everything I showed you here fits in my backpack and my carry-on. So yeah, it's doable. But I know there's other things other people may need, other medical equipment. So just make sure all those things are compatible. You have the right adapters for those and a converter for that as well. Okay, any questions? Right? What? Huh? No. Okay, all right.
this one, right?